All right, thank you for joining us today. It is December 17th, and happy holidays to everybody who's watching. I've been waiting with anticipation for this webinar. This was a big hit the last time we had Dr. Grandela join us for one of our support groups to talk about anxiety and depression and dealing with vision loss. This is something that I think a lot of patients who come and see me want the opportunity to hear and want the ability to express that in the support groups. And so it was a big hit when we had you join us for that live session. So glad to do a recording with you today and to have Gail Grandela join us as well, who's also a licensed counselor and deals a lot with these issues too. For those who are brand new to these recordings, this is our monthly informational webinar. We pick a different topic every month at ViewFinder and try to create just a library of different things involving vision impairment, and what somebody who has vision impairment might want to know, different things you can learn, skills you can gain, just more resources added to what you can do and think about. So today we've got a couple psychologists here with us to talk about vision loss and the grief that comes with that. How do we adapt to those changes? How do we overcome that? The ViewFinder is a low vision optometry clinic based in Arizona, also in Utah. We see patients and give them resources and connections and work on things like glasses and magnifiers to maximize the vision you have and give you all the tools we can to stay active, stay independent, continue with the things that you love to do. So that's a little bit on us. I'm Dr. Carlos Grandela, and I'm the head doctor at ViewFinder. And I have with me Dr. Jorge Grandela, my father, and Gail Grandela as well. So I'll turn the time over to you guys to talk a little bit about Bridge to Wellness Centers.
Okay, good evening to you in Arizona. It's 8 o'clock for us here in Virginia. I'm Dr. Jorge Grandela, as Carlos, Dr. Grandela in Arizona mentioned. We are licensed mental health providers. Our company or our agency is Bridge to Wellness Centers, and we're located in Northern Virginia. The premises of our philosophy in therapy is dealing in a holistic view that the well-being of the individual, not only physically, but emotionally, and all the aspects that go along with that to maintain a good balance in life. Because we know how physical health affects emotional, mental health, as well as mental health affects our physical health. That being said, we attempt to provide the type of therapy that kind of brings all these aspects of who you are and your well-being to be able to help you be able to cope with whatever stress, whatever situation is going on in life. Anxiety is part of life. Depression is part of life. We are in a society and in a time in our lives right now where we are all at one time or another experiencing anxiety and somewhat depression. So a little bit about us. I am a licensed marriage and family therapist. I also work with a lot of chemical dependency clients. I also do a lot of family therapy in combination with that. I will turn the time over to Gail Grandela so she could talk a little bit about what she does.
So my name is Gail Grandela. Obviously, I'm Dr. Grandela's wife, and I have been in the mental health arena for about 35 years. I have worked in all aspects of mental health to include inpatient psychiatric settings to outpatient community services, insurance companies, and now I work for a large health system in Northern Virginia where I do a lot of health education. So a lot of what I deal with is the combination of mental health issues as far as anxiety, depression, that are impacted by health issues as far as anything from heart problems to any type of chronic illness, cancer, COPD, heart problems, lung problems, anything that impacts your health. And I do a lot of education on those areas to help patients understand kind of the signs and symptoms that are going on and what they need to report to their doctors, because the more we know about our health issues, the more we can manage them better. I do a lot of resource education because a lot of people just don't know where to go to get information or assistance with whatever problems that they're having. So a lot of what I do is research resources for whatever they need, whether it be things as simple as oxygen or canes or walkers, to more complicated things as far as looking for long-term care services, applying for Medicaid, helping to apply for Medicare, for disability, and helping people to know where they need to go to get these services.
I didn't mention, and pick it up after what Gail said, I didn't mention how many years I've been doing this because I go back to the Stone Age, where actually we didn't have any computers or documentation. We did carve everything in stone. A little joke there on the side. So I wanted to begin kind of talk a little bit about depression and anxiety, and how is that part of the comorbidity that we find with individuals who are losing their vision, or low vision, or losing their vision. Interesting studies that have been done by the National Institute of Health, for example, where they looked at a group of individuals that were affected with AMD, and how that was impaired their vision. One of the main therapies that they did with this group is called behavioral activation. Okay. Now I'm a cognitive, my background in the type of therapy, I'm very cognitive behavioral. So this kind of, it was really interesting to me from the perspective of behavior activation and what that meant. Well, simply it means that what are the things that we could do to actually promote a better quality of life for you. One of the main points that sometimes with our clients, regardless of depression, anxiety, whatever is affecting, we focus as to the quality of life that you want to have. Okay. And a lot of times we, especially when we're depressed, or we're in a point in life where we're actually grieving this loss of whatever vision or whatever else we have that we're losing. It could be motion, could be ambulation, could be a number of things. And we focus on the negative part of that, the things that I'm not able to do anymore, versus what are the things that I'm actually able to do, or I could do even better with the help of different adaptive resources, technology. Okay. Now, in this group that they had actually occupational therapists come in and help these individuals with these adaptive technology resources to be able to improve the quality of their life. And because they did that, and it was as simple as, helping them be able to read better, more lighting in their house, a number of things, what kind of, some of them were doing crafts, and now because of the issues of losing their vision, so they were not able to do that anymore. And with these adaptive devices, they were actually able to feel that I could still do some of these things that I found enjoyment in. Again, we're focusing here, you know, and I don't want to spend a lot of time about talking about depression. We all know what depression is, you know, so that lack of motivation, that lack feeling sad, that sadness, overwhelming sense of, you know, I'm low self-esteem and low self-image. And I want to focus today a little bit more as to how could we actually improve that? How can we improve the quality of our lives? And when we do that, and part of that is that self-care that we do, that is so important. You know, in my experience, working in, for example, in rehab medicine in the Navy, I'm a retired Navy, working in the medical field, but specifically in the rehab medicine, rehabilitation medicine, and physical and occupational therapy. There have been so many individuals that I have been able to be fortunate, because it was a blessing to work with them and see individuals with strokes, traumatic injuries, you know, a lot of veterans coming back, you know, loss of limbs, loss of sight, their cognitive abilities not being there anymore, and being able to help some of these individuals, okay, obtain the best quality of life that they could have at that point in time. And because of that, the fulfillment or the sense of accomplishment that they actually had, because they were able to do that. Individuals that at first couldn't ambulate, for example, you know, they were wheelchair, and then little by little we worked on strengthening muscles and being able to coordinate movement to the point that they were actually ambulating by themselves. So going back to this study of the National Institute of Health, they found that depression and the anxiety for some of these individuals actually decreased for over 80%. And some of those that still needed additional adjunctive therapy were actually went and were you know, using medication, antidepressants, anti-anxiety medicine, and that actually helped them. Meaning that, you know, when we suffer from depression, for example, such a thing as seasonal affective disorder or SAD, okay, we know that the weather is going to affect us. Behavior activation, or that cognitive behavioral therapy, allows you to say, what are the things that I need to do, for example, during the winter period of time, especially if you live in the eastern part of the country, or northern you know, region of the continental US, that you know, that is going to get gloomy, dark, cold, all these things that people who suffer from SAD or seasonal affective disorder are going to be affected. What are the things that we could do? More lighting in the house, ability to exercise, do these things that are promoting a better quality of life. I'll turn over to Gail. Maybe she may want to say something about that also.
One thing that I was researching before we came and participated in this webinar was, what kind of resources are there available in Arizona? And so I was looking at the Arizona Center for the Blind and Visually Impaired. And as much as I know that Dr. Grandela with his Low Vision Center has a lot of adaptive devices that can help people with low vision and vision impairment, there are also a lot of resources that the Center for Blind and Visual Impairment can help you with. And I think what has a really big impact on any of us that have any type of disability is, where do we go for resources? How do we learn to adapt to whatever is going on with us? And if we can have those resources, the support groups, the Center for the Blind and Visually Impaired, they have support groups that you can participate in. They have assistive technology that if if your insurance doesn't cover, if you're not a veteran that has services through the VA that you can get, there are usually some sort of grants through the state that you can apply for, and other assistive technology that can help you learn your way around your house again. I am sure that a lot of low vision and visual impairment is the inability to orientate yourself around your house, around your surroundings, whether it's outdoors. And the Center for the Blind and Visually Impaired have all these types of resources that you can tap into. They have social recreation groups. They have orientation and mobility training that you can get into. They have basic daily living skills that if you're losing your sight or have lost your sight, that they have people who can come to your home, help you orient to your house, help you learn how to cook, how to clean, how to just be mobile around your own surroundings, and be able to be as independent as you're able to be. I think that's one of the biggest things with any type of disease that we have is that lack of independence that we lose. And as we get older, or as we lose this type of ability, we all want to be independent. And it's scary to lose that independence. And this center just has, they have grants and things that you can apply for. They also have rehabilitative services that can help you with other resumes and learn new or different skills, if that's what's needed for whatever you're doing now. If you're not able to do that, they have retraining programs that can help you. So I'm going to give you the number for the Arizona Center for the Blind and Visually Impaired is area code 602-273-7411. A lot of the programs they have, you can apply for services and talk with someone there so that they can help you figure out, what do you need? How can they help you to become as independent as you have always been, to retrain yourself, so you feel that independence again, that you can take care of yourself. It's great if you've got family that's available. Not all of us have family around that are able to make those calls for us, or help us apply for things online, but they will help you do those things.
So not only do we have the resources available there and the ability to actually be able to obtain those services, but I also want to talk, going back to that behavioral activation, okay? Because I want to activate you. I want to activate your behavior in thinking about taking care of yourself. That self-care is that care that you give to yourself. Okay? And that means that you have to be able and willing and attempt, even if you don't feel like, to be able to, for example, get up in the morning and do the best you can to take care of yourself in the sense of the activities of daily living. And because of the devices, adaptive devices, and other services that you may assistive technology, support groups, and other services that you may have, may actually enhance that ability to do that. Still up to you to be able to actually be motivated and just get up and go and do what you need to do. What do I mean by that? I normally, let's walk away from low vision right now, and let's just talk about individuals who I see all the time, and they're majorly depressed. They're suffering from major depression, bipolar disorder, depressive type, and other issues, even to the point that they, in individuals with schizophrenia and things like that, that are, serious. In the fact that perhaps their whole career plans and employment has changed, and there has been a decline in that quality of life. One of the points that sometimes I hear from a lot of my clients that says, George, I just don't feel like getting up in the morning. I just don't feel like getting out of bed. And I think we focus again more as to, but I used to be able to do this and this and this and that. Okay. And now I just lay in bed, it's impairing your ability to function. One of the things that we attempt is to get out of bed, make your bed so it's not so comfortable that you go back and you stay in bed all day. Okay. Get up and take a walk. Go and I have some clients that I tell them is that go and get yourself ready as if you were going to work. Okay. And they said, but I'm dressing up. And say, yes, I want you to dress up. And here's what happens during this process. Okay. And it's not just George talking about that. Been there, done it. As my clients saying, I actually feel better when I got up and I took a shower. I haven't taken a shower in the last 10 days, George. And I actually got up and went and took a shower and got dressed. And women will say to me, ladies will say to me, and I actually put a little bit of makeup and I actually felt better. And it's like, that's what we want to do. We want to feel better. We want to improve the quality of life. Okay? And we have to find ways to improve that. There are individuals, for example, that are no longer able to ambulate without the use of prosthetic devices. Well, once they have those prosthetic devices and they go through their own rehab process, okay, they're able to walk. Some of them are even able to run, okay, and it's interesting to talk to these individuals and find out what motivated them to get to that point that they function. They were no longer thinking about the things that I used to do that I'm not able to do that. But what other things can I do now that will actually improve the quality of my life? Okay. And that's important to be able to, if you like to read, and because you're low vision, because you have difficulties now, and you don't have the proper lighting, there may be resources, as Mrs. Grandela mentioned, Gail mentioned, that are allowing you to perhaps read audiobooks that you can still listen. Okay. Meditation is a wonderful thing. There are numerous ads, several ads, apps, not ads, apps, I'm sorry, available on Google that you could Google and find out, and they're free, some of them, and allows you to do some meditation. Meditation is a wonderful thing for us to do. It really is, okay? Being in mindfulness, being in the, Mrs. Grandela is showing me one of them is called Insight Timer.
And it's free. So that's the best thing is it's I always look for things that don't cost anything.
As we do that, as we actually make use of some of these resources, there's a change because of that behavior. We talk about cognitive behavioral activation. Again, is that we know research shows that when we change our behaviors, our cognitive distortions, that negative thinking kind of begins to change. And this behavioral change that we are doing here, the changes that we're making, okay, enhances our ability of our positive frame of mind. And with that comes changes for our own body that we could do that. Okay, we feel we feel motivated, we feel better about ourselves. We feel that we're able to do things that perhaps we never tried doing it, and now we're doing it because of changes that we're making in our lives. And it's important that we recognize that perhaps because of the stages of life that we go through, things are going to change. Our bodies are going to change. You know, as we get older, I know I'm there. Things begin to change, and perhaps I can't run a marathon anymore. But it doesn't take away from the fact that I could still get in my treadmill and maybe walk and get that exercise that perhaps my body needs. We know there's a connection between physical exercise and health, well-being. Okay, not only physical, but mental health. Okay, anxiety for a lot of my clients that suffer from panic attacks and anxiety. One of the first things that I ask is, "Are you exercising?" Well, I used to, but I don't do. You know, I used to go walking. I used to go jogging. I said, I want you to get right back into that. Well, my knees won't allow me to go bicycle or to run anymore, but I have a stationary bike at home. Okay, why don't we get into that stationary bike and kind of do some of that? So I'm pointing to all these things that sometimes we don't look at, that we're able to do, okay, that will enhance our how we feel about ourselves, and how that changes and improves the quality of our life. Again, I got to go back to that quality of life because that's what we're looking for.
To add on to that, I think that when Dr. Grandela is talking about anxiety and depression, and it's kind of that negative feedback loop that is in our head, that what I call the broken record thoughts that are always in our head saying, oh, you can't do this. Oh, I'm not good enough. Oh, I can't. So there are actually physiological changes that when you get into what I call this negative feedback loop, they actually cause chemical changes in your brain, and they cause these neurotransmitters and things to flood your brain with these chemicals that continue to enhance this negative behavior and these negative thoughts. So what I call kind of fake it till you make it, sometimes that's what you have to do. You have to stand up and say, okay, I'm going to do this, or repeat kind of some of those positive thoughts that I can do this today. I can walk around the house. I can learn to touch the walls and feel my way around the house to be able to orient myself around the house. And you learn different adaptive techniques to be able to feel better about your surroundings. And slowly but surely you change, and you have to create these positive thoughts, or what I call positive affirmations, that you're telling yourself these positive things on a daily basis. And eventually you change that negative feedback loop of all these negative thoughts that are going on into your head to more positive things. So instead of going backwards, you're going forwards. You start changing these negative things to more positive things. And that actually creates a different, more positive physiological change in your brain that starts releasing different endorphins and different chemicals to make you feel better. I know it sounds a little weird, but it really does work. It doesn't happen overnight. You have to do it on a daily basis. And a lot of times what I tell my patients is, find some positive thoughts that you can tell yourself on a daily basis, and just repeat those things, even if you're doing it out loud. I know it sounds silly to talk to yourself like that, but it's actually creating that positive feedback loop into your head to make you start feeling, and eventually you create this more positive outlook, and it's a more of, I can do this, I can do that. instead of I can't. But it does take time.
In addition to what Gail was talking about, I'll add a couple of more things. We have to be able to deregulate or dysregulate that mood. And at times it means that I have to be in the here and now. And if I'm feeling sad or I'm feeling anxious, and I know this may sound, again, as Gail said, a little uncomfortable for many of us, okay? But it's okay to feel that way for that moment there and accept that, okay? But we don't have to stay in that moment either, and that feeling, okay? What is it that we could actually do to change that? Let me share with you some of the things. For example, journaling, okay? So if you can't write, you could dictate into your phone, okay? Or a recording device that you may have, okay? Journaling or dictating, orally journaling, for example, it's that free association. You're not thinking as to what you're saying. You're just emoting and you're verbalizing and expressing that. Goes along with support groups. Why are support groups so effective for a lot of us? It's because it allows us to go in there and just kind of express how we're feeling. And we leave that there. Along with that comes individual therapy, okay? That is so important sometimes for us to be able to go and find that one individual that we basically come into that office, feel secure, and just kind of literally dump all this negative stuff there. And when we leave feeling better because we left that kind of negative emotional feeling or whatever it is. It is okay to feel sad, but I don't have to say sad all the time, okay? There may be a moment that I'm angry. Anger is, I know it has a negative connotation, but anger is a healthy emotion at times. We could have righteous anger sometimes, okay? And we could have anger that allows us to be able to say, I really feel that this is unfair and there's nothing wrong with that, okay? Because, we don't plan to lose our vision. We don't plan to lose our hair, but it happens. A little joke in there. So not everything has to be negative, okay? One more thing that I would like for you to if you're interested in watching the movie, okay? There's an old movie by Cuba Gooding Jr., okay? And it's about the life of a retired Master Chief in the Navy, Master Chief Petty Officer in the Navy, that his name was Michael Brashears, okay? And not only was he in the Navy, he was a Navy diver, he was a Navy cook to begin with. I believe that he's already passed on, but he was a Black Navy cook. And during that period of time in the Navy, African Americans, Blacks were not allowed to do a lot of other things except cook and other things. And he became, after trying, he became a Navy diver. Long story made short, he lost both of his legs during being a Navy diver, an accident, okay? And the struggles that he went through with prosthetic legs and still was a Navy diver. Why am I mentioning that to you? Because it's really an interesting movie if you look at it from a psychological perspective and look at the human being that is not willing to give up, is now willing to say, oh my gosh, I used to do this and this and this, and now I can't do it. Perhaps, how can I still do some of the things that I did and I'm not giving up on myself? And that's I think that the main point of the movie there, based on a true story. I met Master Chief Brashears many years ago in the amphibious naval base here in Little Creek, Virginia. Okay, and there are a lot of other movies like that, but this is one that I particularly it was very important to me, not only because I'm a retired Navy Chief Petty Officer, but also because of working with so many individuals and mainly veterans that have had so many traumatic things happen to them, both physical and emotional. and how the willingness for them to continue on with their lives and to improve the quality of their lives has made a difference. Okay. With that, I'll open up to see Dr. Grandela to see if you have any questions for us.
I absolutely have plenty of questions. I do want to turn time over to the audience members. If any of you would like to unmute your microphone and would like to ask a question, you're more than welcome to do that at this time. If you'd rather be anonymous and not be recorded on the video, you can send a question through the chat. You can do that towards the bottom of the screen. There is a green share screen button. You don't want to hit that one. You want to go to the left of that where there's a chat bubble and type in your questions there. I'd be more than happy to read your questions out loud, but you're welcome to unmute at any time here and ask any questions. So as you think about what you might want to say, I'm going to pull a couple questions that I had prepared. So one of the things that comes up quite a bit is whether or not you should involve a personal counselor of some kind, whether that be a professional psychologist, whether it be an ecclesiastical leader. What's the benefit of having a personal counselor to go to when you're dealing with grief and loss and frustration like this?
I think one of the biggest advantages to having somebody to talk to is a safe place to be validated, for somebody to hear your thoughts, your feelings, your frustrations. That's a lot of what I get from any of my clients, is that it's a safe place so that they can talk about things that they don't want anybody else hearing. And that's okay. We want to be able to validate all your thoughts, all your feelings, because whatever you're feeling, so many of us think that I'm alone. Nobody has these same feelings that I'm having. And that is probably one of the most isolating things to us when we have a disability, is that we're alone. And a lot of times in going through counseling or going to support groups, we really find out that, and it's very freeing, that we're not alone, that other people really do feel the same way that we feel, that we go through that same grieving process for any type of loss that we're having.
And I think that, to add to what Gail is saying, I think that connection, the human connection, whether it's an ecclesiastical, person or vocational rehab counselor or psychologist, is that connection where, as Gail is saying, one, you feel safe, but also you understand that you're not the only one feeling these feelings, that there are other individuals that are, one of the things that I always attempt to do with my clients is to be able to normalize, and I use that word very careful, normalize that for them, that it's like, yes, this is very typical of individuals who are grieving this process, because there's a loss of a family member, or loss of a relationship, a loss of health, abilities to do things, whatever it may be. And when we do that, when we make that connection, I think we begin to feel heard, and we feel that we could process these emotions and these feelings
And move forward.
Absolutely.
And be able to start to accomplish the things that we really do want to accomplish, despite whatever disabilities that we have.
And not everybody feels comfortable with a support group. There are individuals that don't feel comfortable with a group, and they rather do individual, or they rather talk to their minister, pastor, priest, and that's okay. I think, by the way, that spiritual, not necessarily religious, but spiritual well-being is also part of that holistic approach to your health. Okay, that is very important.
So similar but a little bit different topic that I think comes up quite a bit during a low vision exam is the presence and absence of family members in the low vision discussion and in the discussion of independence or codependence. So many patients come into the exam with a loved one, with a spouse, with a close friend. And we get kind of two conversations going on, depending on the situation. Some patients will come in and go, I'm motivated, I want to do these things, but nobody is supporting me in this desire for independence. And then on the other hand, we'll get patients who are almost kicking and screaming brought into the exam room with people who say, we want to motivate you to do these things, but you don't seem to want to get motivated. So I know that's kind of two different questions in one, but could you give me some feedback on your thoughts and your approach to these situations where maybe we want people to get more involved and maybe at times where people don't want to be involved?
So I think both of those are really good questions. I think sometimes families can be a great support.
Mhm.
Sometimes they can be a hindrance, depending on they feel they want to do everything for us and don't want to let us do the things that, or encourage us to do the things that we can or want to do for ourselves. So for those that don't have families or that social support, part of it is, how do we need to find that social support?
Mhm.
And a lot of that is through other organizations, whether it be church organizations or the VA or whatever organizations might be out in the community. Find some sort of support group so you can find somebody that can help support you through whatever this is. If you're not motivated, and a lot of that unmotivation, I guess, comes from being depressed or scared that, what if I fail? And we all fail at things. And I think a lot of times we're really afraid to do things because of that fear of success. But sometimes if we don't fail, we don't learn. And sometimes we might fail a lot before we learn the right thing to do. And we've got to learn that's okay to fail. We might fall down, but we get up. And you just continue to get up, and it's kind of like the little train that could. I think I can, I think I can, I think I can. And eventually you will get it. You try different things, you try different ways to achieve things until you find something that fits for you. And it's going to be different for everybody.
I think there's also a fine line when it comes to families. For example, when in that boundary, where do we set that boundary also for the families and for the individual? Okay. And sometimes, for example, when I'm doing family therapy, and especially with adolescents, teenagers, and the parents come in and they bring the adolescent and they're pushing him into therapy. Sometimes we're not ready for that. Just, and sometimes what Gail is talking about, sometimes we need to fail, or we need to get to a point that we actually say, I do need to talk to somebody. I do need help. I do need an assistance with this. On the other hand, sometimes I have the family that is overwhelming the client because they want to do everything for them. Okay. They don't want to allow, this happens a lot. For example, I do a lot of grief work with individuals who have lost a family member. And sometimes the families want to make everything okay for them and better for them. And actually, it backfires on them in the sense of the individual who's going through that grieving process is angry with them even more so, because you're not allowing me to feel that grief. You're not allowing me to feel that loss.
Or to be independent.
And that's important. how do we gauge that? How do we balance that?
Set boundaries.
It's by setting boundaries and allowing, as Gail would say, to have that individual become more independent. And sometimes it's having to stay off to the side and say, we're here for you, to let us know how we could help you.
Let us know how.
And sometimes the individual may not be ready at that point in time, but just being there for them makes a difference sometimes.
I think a really important part of this that we keep coming back to is how unique each case is.
Absolutely.
You know, I say to a lot of patients, I could have 10 macular degeneration patients, and all 10 of them will have a different set of goals they want to achieve, a different level of vision, and a different comfort with the solutions and resources I try to provide. So I think the same thing applies to mental health. If you had 10 patients who are losing their vision, who have depression from that, everybody has to fight that in a different way.
Absolutely.
And you've got to figure out what is right for you. And sometimes it is sitting with that depression and grieving that loss for a little while until you're ready to move forward.
Absolutely.
And you need to be able to the biggest thing is if you do have people to reach out to, just let them know that I'll reach out to you when I'm ready. I may need a little push every now and then, but help them understand kind of where you're at and what your needs are. The biggest thing is communication.
And this is very important with families that are overly involved, that the individual himself needs to set some boundaries and say, okay, I'm okay where I am right now, and I will let you know when I need. Okay, but you can't fix everything for me right now. I just need to go through that process, and it's very important. One of the other points I want to make is that, especially whether we go to a support group or even with our own families or even with a individual therapist, is that we have a goal, we have a certain objective that we want to work on, okay, in mind. And this is what, going back to communication, this is what we need to communicate to the individuals, okay? Because sometimes the family wants to help, but they don't know what type of help or how to, okay? And they're trying to, at the same time, they're trying to fix everything for you, and the individual is just being even more frustrated because it was like, no, I'm trying to achieve at least this one goal, and then from there, it's a stepping stone to somewhere else. And that needs to be communicated.
One last thing I'd like you guys to touch on as we come up towards the end of our time. I love the approach of taking small steps and deciding for yourself, what's something that I want to work on, and let's focus on working on this. For many patients, there becomes a fear or a disillusionment with the idea of being seen as being different, or being outed as someone who has a vision impairment. We have buttons at the front of the store that say, I have vision impairment. And there are patients who love that, and there are patients that would not be caught dead with that. And the same thing with a white and red orientation cane, which is a worldwide signal for vision impairment or blindness. And I often talk about that with patients who are stumbling over things or tripping. And there are patients who go right through that and go, you know what? Everywhere I go with my cane, no one asks me why I trip into things anymore. Nobody thinks that I'm drunk when I'm at the restaurant and I bump into a table because I can't see where I'm going. Right. And then there's other patients who go, there's no way to look at me and know I have a vision impairment. I don't want you to know that I have a vision impairment. How can people wrestle with this ability to be a self-advocate and whether or not to identify as a person with vision impairment?
Would you like to address that?
I think that is such a huge issue for so many people, is about, I don't want to be different. And but in the world today, one of the things that I am learning from young people to elderly people is we are all different. And it's okay to be different. And I think a lot of us that are getting into our senior years, the way we grew up and the way we were taught was, don't let people show your emotions. Don't show them your emotions. Don't let people know anything's wrong. And that is so ingrained in us that it's hard to let it go. But that's one of the things that, and I talk with an elderly population on a daily basis, but that's one of the things that we've got to be able to understand and let go of, that it's okay to be different now, that it's normal to, and I know this sounds weird, but it's normal to be different. Everybody is coming out with, I'm different this way, I'm different that way. And as much as hard as it is for us to embrace being different, somehow we need to accept that it's okay. And that's a hard one to do sometimes, that, you know, depending on our upbringing, because things get so ingrained. And sometimes it's about just kind of that mantra of repeating to ourselves on a daily basis, it's okay to be different. It's okay to let people know that we have an impairment, because if we let them know, they might be able to help us, even if it's something as simple as getting from one side of the street to the other, trying to navigate our way through a hall or through a restaurant. You let somebody know what it is that you need, and they can say, okay, I need you to walk forward about this many steps, and then you're going to turn right, and this is where your seat's going to be. Or they can say, here, hang on to my arm and let me lead you.
But if I could add to that, but here's the reality of things, okay, reality, okay, is that we live, and this is my opinion, and it's not based on research, just in a very judgmental society sometimes, okay, and this is changing, this is evolving. You know, you could see that, for example, with models, you know, and the idea that you have to have this perfect body, whatever that is, okay, and then now we have full-size models, right, and so on and so forth. But it's the stigma. Because I find this all the time with individuals who suffer from severe mental illness, okay, and schizophrenia and things like that, bipolar disorder and things like that, and the stigma that I don't want people to know that I suffer from this, or I suffer from depression, or I have panic attacks, and it goes back to the individual work that you have to be able to accept, and God goes along with what Gail was saying, but you have to be willing to accept that this is happening to me, or this is going on with me. No different than, and I use this all the time with mental illness, because the stigma is a big stigma that I have to take psychotropic medications to control my mood, or not to hear voices, okay, or see things, okay, and when I am medicated, I'm able to function and I feel good about myself, but I have to take this medication and there must be something wrong with me. And I don't want people to know this. And the acceptance is that individual work that we do, that would say, I'm okay. I just have to accept that some things in my life are changing. You know, for give you an example, I've had young clients at first year of college. Okay, they're 22, 23, 24, and they have the first breakdown of a schizophrenic episode. Okay, and life changes. Talk about a enormous change in their lives, to say the least. Okay, and what the shame that comes with that. and the ability to say, well, I'm different, and why this happened to me, and how people are going to look at me. So it goes back to that acceptance work that you have to do in therapy, and be able to be okay with the fact that this is who I am right now, but I'm no less than I was before. You know, I may have a need for adaptive devices. I may have a need for support services. Okay, but it's okay. I could do that. I could do this. And I think it's important sometimes to understand that process. And it's a process. It doesn't happen all at once. Okay. I hope that helps.
Thank you both so much for your time tonight and discussing these, intricate and complex issues. Something that's very personal for each person who's going to come to talk about this. I hope that those of you who view this have gotten a little bit of insight into how you can adapt and encounter these frustrations and this process of dealing with something that's outside of our control. No one chooses to have glaucoma. No one chooses to get a stroke that wipes out half of their vision. I want to bring up again, ViewFinder Low Vision. We have lots of resources. We're well connected in the Arizona area. So the Arizona Center for the Blind and Visually Impaired, that's a great nonprofit organization in this area with a lot of resources available. If you would like to know more about groups and support groups in this area or other resources, we would love to talk to you about it. Just give us a call at our Mesa or Sun City offices. We're easy to look up, viewfinderlowvision.com. And if you're watching this, you're likely one of our patients anyway. But if you would like to talk to somebody more experienced with mental health and ask questions to Dr. Grandela or to Gail Grandela, again, they're part of Bridge to Wellness Centers. You can find them online at bridgetowellnesscenters.com. Or you can connect to them over the phone at 703-752-6181. And I'm sure they'd be happy to talk to you more.
May I also add, Dr. Grandela, that the website psychologytoday.com is a wonderful resource for individuals who may be actually wanting to talk to a therapist. And you
in
could
their
in their home area. And it's a wonderful tool. You could go in there and you actually could read about the different therapists and the type of therapy that they do. Okay.
And the insurances.
And the insurance that they take and so on and so forth. Okay.
Wonderful.
It's been a pleasure. Thank you so much.
So again, for those who've been watching, this is recorded. This will be uploaded on our social media and web pages. So if you want to come back and view any of this again, it should be available starting next week. Have a wonderful night, everyone, and we'll see you again towards the end of January for our next informational webinar.
Good night.